I remember where I was when I got the phone call that I was going to have to see an oncologist. And although I had somehow made it through college and graduate school and I was somebody's mom, I was like, what do you mean I have to go to an oncologist? And they're like, well, it's like a large mass. It has to come out and we need to make sure that an oncologist is there so that it's, can determine if it's cancer and get it taken care of right. So like at that time, my knowledge about ovarian cancer was literally that you get it and you die from it. And I remember Angelina Jolie had done the whole hysterectomy and mastectomy because of her mom had died. That was like literally all I knew. And I was under the impression, I guess maybe because of that it was mostly genetic, but I've read that like only 15% of cases are genetic. So could you talk to me a little bit about why this is a disease that women need to be aware of all ages and demographics and health histories?
The reason that all women need to be aware of it is that there are multiple types of ovarian cancer. There are cancers of the ovary that are the most common, which are more common in elderly patients or women as they get older into the 50s, 60s, and 70s. But there are other types of cancer that are frequent in women that occur at a younger age. Germ cell tumors, which are the most common ovarian cancer that we see in younger women, is a disease that can be deadly for sure, but is also one that is very curable. And then there's the stromal tumors that you have that are act more benignly for the most part, but can also be problematic because they can recur. So all of those are different types of cancers that originate from the different types of tissues that are in the ovary. And all of them have their own specific characteristics and their own ways of being treated. So I think women of all ages should be aware of that. And whenever something is amiss or different or goes on longer than they would expect it to be because of a short-lived problem, then they should seek a physician's input or a workup from a physician. Mm-hmm. Because there's a lot of things that you can detect, and the earlier you can detect them, usually the better things work out.
Yes.